Hi, my name is Katie Swanson. I'm the Health and Nursing Care Administrator at SCARC, and I'm here to talk about the coronavirus, but specifically COVID-19. Before we get started, I want to talk about the number one most contagious thing in the world right now. Does anyone have any idea? Fear. Fear. We are programmed to, and instinctually to react to fear. It's how we survive as a species. So, and also lingers in us. So think about Nightmare on Elm Street. You know, you're watching the movie, you're all tense, and even after the movie, you think you're over it, and then you leave all the lights on because it's in your body. It's instinctual, whether it's recreational or not. In ticks and spiders, you find a tick on your dog or whatnot, and then you're itching and scratching the whole rest of the day, thinking, freaking out that you have something. So, also birds chirping. Say we're going on a hike, and you hear all the birds alarming each other about a potential warning, right? That a human is in the woods. Right now, we're all birds chirping around the water cooler. We're protecting ourselves, assessing our need for danger. And as far as the media goes, I kind of think of this as snowstorms. So I don't know if we're gonna get a flurry or 3 feet, but it's like, we're gonna have a huge snowstorm. Get your shovels, and there's nothing left on the shelves. So I kind of think that's what's happening now. Everyone's kind of in a panic mode, but really one thing at a time. We'll handle it. We think in our head, okay, maybe I should pick up a bag of salt. Oh, I know where my shovel is. We're gonna be okay. Calm the mind and the body. So when we get all revved up from our fear, we just need to think intellectually. Okay, how much danger are we actually in? Is it just our fight or flight system working? So coronavirus. Coronavirus has been around a long time. It's an umbrella term, but so someone might be diagnosed with a coronavirus and it's not COVID-19. COVID-19 is the specific strain of virus that we don't have immunity for right now. They're in the works. The vaccine is in the works, and next year it'll probably be in our batch of vaccines, just like the H1N1 vaccine is currently in our flu for this year. It changes every year. So transmission. COVID-19 is thought to be spread person to person between people that are in close contact, 6 feet. Though through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or nose of people who are nearby or possibly inhaled into the lungs. So person to person droplets, and also contaminated surfaces or objects. It may be possible that a person could get COVID-19 by touching a surface or object that has been on the virus and then touching it on our own mouths, nose, and eyes. This is thought to be the main method of transmission, though there is some talk about, between pets and whatnot. So we're not going to touch our noses and our mouths especially. Prevention. We're going to do what we already know, which is universal precautions. We're going to assume that someone has a potentially communicable disease like we always do. It's our duty for ourselves and others to protect ourselves, protect our individuals, our families. It's the healthy, right thing to do. Hand washing. We're going to talk about that more in a minute. Touching face awareness, resist. It's a good opportunity to know how much you actually touch your face throughout the day. And it is acceptable to touch your face, your nose, your mouth with clean hands. Social distancing. So in the video that you just watched, we talked about how the virus cannot move without us picking us up. So I think of it as we are the driver and the virus is the hitchhiker. So we are going to keep on driving. We're not going to pick up the hitchhiker. If we don't pick up the hitchhiker, it can't go anywhere. It'll be extinguished. That's why we have a lot of the social distancing. That's why communities are closing some community outings. Some schools are closing, colleges. And stay at home if sick. Those of you that have worked with me know that I say this all the time, despite the circumstance. If you're home, if you're sick, please be home. Don't spread it to others. It's the respectful, responsible thing to do. And cough and sneeze etiquette. Cough in your elbow, tissue, throw it out, wash your hands afterwards. And cleaning and disinfecting, again, something we should be doing all the time. We'll talk more about that in a second. Hand washing times. I put this link here. It talks about the science of hand washing. There's so much that is preventable, and what kind of illnesses and diseases occur from not washing your hands. I love percentiles and percentages, so I love that if you want to check that out. So hand washing time specifically: upon waking up, before leaving the house, upon entering the program or office, before eating, after touching frequently touched objects, if your hands are visibly soiled, after using the restroom, before leaving program or the office, upon entering your house, before handling food, and after removing gloves. So again, really we should be doing this all the time, not just for COVID-19 prevention. Cleaning definitions from the CDC. Cleaning refers to the removal of germs, dirt, and impurities from surfaces. Cleaning does not kill germs, but simply removes them. It lowers their numbers and the risk of spreading infection. Disinfecting, it refers to using chemicals to kill germs on surfaces. This process does not necessarily clean dirty surfaces or remove germs, but by killing germs on a surface after cleaning it, it can further lower the risk of spreading the infection. Preventative cleaning. So that's really what we're going to focus on right now, but again, always we should be doing. We should be cleaning frequently touched surfaces approved by the EPA, such as Clorox and Lysol wipes. So tables, armrests, doorknobs, and edges, not just the doorknobs, the edge. Hand railings, desks, light switches, handles on the fridge, microwave, oven, drawers, desks, toilets, faucets, sinks, computer keyboards and mice, cell phones and telephones, remotes, steering wheels, writing utensils, our refillable cups that I carry throughout the day, adaptive equipment including wheelchair components, all parts of the wheelchair, the part that we're pushing, the part that they're touching, keypads, keys, copy machines, etc., etc., etc. Okay, so we're also following the label instructions on the cleaner. Some might say, in order to disinfect, it needs to be on the surface for 3 minutes, 10 minutes. It depends on the product, so you'll have to read the instructions. And also, we're going to wear gloves and make sure that there's good ventilation while we're cleaning. So preparedness. Again, we're going to do what we always should be doing, following licensing standards and our own emergency preparedness plan and our policy and procedures. We're going to have 2 weeks of food and supplies. Prescriptions, check the need for our refills. Over-the-counter medications, especially NSAIDs and cold and flu medicines, over-the-counter signed orders, as per the over-the-counter signed orders. Some suggested supplies, surplus of gloves, paper towels, working thermometer. I like the Braun thermoscan personally. Hand soap, hand sanitizer, trash baskets, and a couple of face masks just in case. If you need these supplies, Diane Banks is doing a lot of the ordering. And also have a backup plan for child or adult care should you not be able to go to work. So some important definitions. Outbreaks. Some outbreaks are suspected, like every year we expect to have a flu season. That would be considered an outbreak, the typical flu that is. That's a sudden rise in disease, usually in a specific area or specific areas in the country and vary in length. An epidemic is infectious disease that spreads rapidly to many people, and it can vary in severity. And a pandemic is disease that's worldwide, multiple different countries. So for some perspective on the COVID-19, this is not our first pandemic. This is not our worst pandemic. So I just wanted to kind of look at some numbers and calm down about it, because everyone, the hype is really up. Everyone's on high alert, and really we just need to relax and chill a little bit. So let's take a look at some numbers over here. The swine flu pandemic in 1918, this infected 500 million people and 30 million people died. And that is with the census in 1918. Right now, that's the same. That would be like having 2 billion people infected and 830 million deaths. So that's 1/3 of the population. If you want to talk about something more recent, in 2009 we had the H1N1 swine flu again. 60 million people were infected and 12,000 people died. So because we're talking about death numbers, we should think about the number of deaths in the US throughout the year. So that's about almost 3 million. If we want to think about the flu season, for the preliminary numbers for this flu season, 2019 to 2020, 13 million people infected and about 36,000 deaths. So if you want to think about something not flu related, we could talk about salmonella, which is primarily a foodborne illness. Over 1 million cases, 420 deaths. So to talk about COVID-19 specifically, 120,000 in the world and 4,000 deaths approximately. And then we're going to talk about specifically the US. So 1,200 infected, around 36 deaths, and how many in New Jersey? One death in New Jersey. So just think about these numbers. Think about how small these numbers actually are when we think about death in the United States, or the number of people, the 8 billion people, almost 8 billion people in the world. So just put in perspective some of these numbers, they're not very staggering. So speaking of high risk, you might think, oh, some of our folks that we serve are high risk. They may be, depending on their circumstance, but they're not just at high risk for COVID-19. They're at high risk for a whole bunch of illnesses that could result in death, such as salmonella. So I'm going to read this slide word for word because it's pretty small print. So risk is considered high if you're traveling from China, living in the same household, or providing care in a home with a person with symptomatic, laboratory-confirmed COVID-19 infection without using the recommended precautions for home care and isolation. Medium risk, traveling from mainland China or a country with widespread transmission, close contact with a person with symptomatic, laboratory-confirmed COVID-19, on an aircraft being seated within 6 feet of a traveler with symptomatic, laboratory-confirmed case, living in the same household or caring for a person in a non-healthcare setting, such as a home, to a person with symptomatic confirmed COVID-19 infection while consistently using recommended precautions for home care and home isolation. Low risk, travel from another country, being the same indoor environment, classroom, hospital waiting room, as a person with symptomatic, laboratory confirmed COVID-19 for a prolonged period of time, but not meeting the definition of close contact. So, not identifiable risk, not applicable interactions with a person with symptomatic, laboratory confirmed COVID-19 infection that do not meet any of the high, medium, or low conditions above, such as walking by the person or being briefly in the same room. So right now, we are at low risk, especially in Sussex County, New Jersey. So even if you're going to the hospital with the symptoms that Dr. Lynn talked about in the video previously, you're most likely not going to be tested. And you might think, why am I not being tested? Because the risk isn't there. And it's up to the hospital and doctors and the CDC to decide who is getting treated and when. So if someone does come down with the coronavirus, the COVID-19, or any other illness, really we should be respectful and be mindful of HIPAA, have respect, and not to hold a stigma. Respect the privacy of those possibly exposed, people that could possibly affected by stigma, specifically could be persons of Asian descent, travelers, healthcare providers, EMTs, and those with allergies. Someone could just be having allergies, right? Stigmatized groups may be subjected to social avoidance or rejection, denials of healthcare, education, housing, or employment, and physical violence. So we talked a little bit already about evaluation and treatment. It's up to the doctors and CDC on who and how to be treated. Highly suspected or confirmed illness. So what do we do first? Just like the video that Dr. Lynn said, we're going to call our primary care physicians first and convey our symptoms and follow their instruction. Right now, they're overloaded with people that are very concerned when you're most likely just going to have a cold, the typical flu, something else besides the coronavirus or specifically COVID-19. We're going to call the administrator on call, and they will call me and the chiefs, and we'll follow the case specifically to consider transmission. Continue all previously stated precautions on slide 4, and some links specifically on how to clean and disinfect the home or program. In isolation, just like we do when someone has the typical flu, we're going to isolate the person, the sick from the healthy, their sleeping quarters, their bathrooms, etc. The person sick and those with direct contact should wear a mask and don't share personal items. Cleaning and disinfecting. So residential, something that is interesting is because we are handling droplet precautions, we're going to close off the area by the ill person for up to 24 hours before cleaning. This is because there's droplets from coughs, sneezes. We don't want healthy people to walk through those droplets. We want them to settle, so it's less likely to be transmitted. So we're opening up our doors, our windows, and leaving it alone. We're going to use PPE, contact and droplet precautions. So this is for confirmed cases. Gloves, gown, and eye protection may be needed. And of course, we're going to up our game on our hand washing. So for day programs and admin offices, same thing, it's just a little different because they're not sleeping in the program. So we're able to block off and leave areas easier. We're going to clean and disinfect all areas used by the person that's ill, focusing on the areas most frequently touched. There's also a hand washing video that the CDC put out. We're going to put that link on our website as well. So when all is said and done, discontinuing home isolation. This is put in place because we want to reduce the risk of transmission, but also what do we do when it's over? It's taken case by case. The doctor and healthcare providers are really going to say what to do and how long to do it, etc. Virus may still be contagious after symptoms subside. So same thing with the typical flu. Some people are asymptomatic and still contagious. So all things the healthcare provider will be keeping into consideration. Return to work note is needed according to our policy and procedure for all communicable diseases. Again, the doctors might be quite overwhelmed and not be so focused on our return to work note, and I'll try to help you with that if need be. So post-pandemic, this is really an opportunity for us, right? Discussing our emergency plans in our own homes, at the group homes, at the day programs, what we could have done better, what we could do next time. It's an opportunity to really freshen our skills, what we should already be doing. And we're going to continue our everyday precautions. So remember, we're talking about everyone getting all worked up. Afterwards, let's try to pay attention to our needs, our feelings, and work through it. So, quiet the mind and body. Some prevention tips. I'm just going to go over the top 10 real quick, or top 6, excuse me. Hand washing. We're going to up our game on hand washing. We're not going to touch our face. We're going to use cough and sneeze etiquette, stay home when sick, preventative cleaning, and social distancing. We're also going to be respectful for others that may or may not be sick. And the lonely hitchhiker. We're going to keep driving by. We're not going to pick him up. He's going to have nowhere to go. Not that big of a deal. And again, opportunities. Opportunities for us to provide a training for the individuals. This is how you wash your hands. This is how often we should clean this surface. Look, I just touched this. I'm going to have a video from the CDC with glowing germs that we could show our guys, our kids, and whomever. We could all learn from it. And these are the references and website suggestions. Again, the video from Dr. Lynn is from Sussex County Public Health Nursing. If you have not seen that video before mine, please refer to that because a lot of my training today is based that you've already read, watched, and acknowledged that, that video. Thank you so much.